अस्सलाम वालेकुम नाज़रीन, आप देख रहे हैं 24 स्पेशल। हमारे साथ मौजूद हैं यूके के हाई कमिश्नर पाकिस्तान में डॉक्टर क्रिस्टियन टर्नर। इनसे हम बात करेंगे कि यूके और पाकिस्तान की कोरोना वायरस के दौर में किस तरह की खास इस वक्त कोऑपरेशन हो रही है, और फिर साथ साथ इस पर भी बात करेंगे जो पाकिस्तान में यूके नेशनल्स पाकिस्तानी ओरिजिन के इस वक्त मुकीम है और जो वापस जाना चाह रहे हैं, जो पूरा ऑपरेशन इन्होंने ऑर्गेनाइज किया यूके की गवर्नमेंट, उस पर भी बात करेंगे। Welcome to the program, Dr. Turner. We are now going to be talking to UK's High Commissioner to Pakistan, Dr. Christian Turner. We are obviously holding this conversation against the backdrop of one of the greatest challenges human civilization has faced in the last century. And we're talking about, of course, the coronavirus pandemic. And we are going to be asking the High Commissioner to tell us about what the UK government is doing currently in terms of bringing back home the stranded UK citizens in Pakistan. And also we will talk about the nature of cooperation that is being initiated between UK government and the Pakistan government in the broader sphere of tackling the pandemic. Welcome to the program, High Commissioner.
Assalamu alaikum. It's very good to be with you.
Walaikum assalam. And we know that you speak pretty good Urdu. We heard in 1.5 minute long message, which was...
Many Urdu kharab hai. I'll only speak a little bit, so I'm afraid I'm better off in English this evening.
Naturally, we're going to talk to you in English, but we heard your 1.5 minute long message. Anyway, let's just come straight to the issue which is on, which is in everybody's mind. Those who are watching this program, especially their loved ones, are in Pakistan, and those who are wanting to go back to the UK. We know that there was this major operation that you were planning to initiate to take back the stranded UK citizens. Can you tell us a little bit more about it? Because we've heard there have been some major developments in the last 24 hours.
Yes, thank you, Nasim. So, we know this is a very worrying time for people across the world. And here in Pakistan, airspace was, of course, closed on the 21st of March. Many thousands were stranded, not where they should be. They were away from home without their medicines. And our first priority was to try and get people who wanted to get home back home as quickly as they could. So we worked with the government of Pakistan and with PIA, who were then the only commercial airline allowed to operate, on a series of commercial flights. And we managed to get back over 7,500 people on 22 flights in 9 days. But when that PIA process dried up, we decided to launch a series of charter flights. And that's what we've announced in the last 24 hours. There will be 10 charter flights from Pakistan, 7 from Islamabad, 3 from Lahore, and they'll go to both London Heathrow and to Manchester starting on Tuesday morning.
So what was the total number of UK citizens in Pakistan who wanted to return since the beginning of the pandemic?
So it's a really good question, Nasim, and one of the challenges we face at a time like this is the scale. It's really the number of Brits in Pakistan, and in normal times we talk about that in a very positive way. It's the close relationship between our two countries, the deep people-to-people ties. I estimate that there are at any one time probably around 100,000 Brits in Pakistan. Yeah. And we think that in the region of about 21,000 of those are what we would call short-term travelers. That's people who are resident, who live in the UK, who are probably keen to get back home. So it's that 21,000 we're focused on. We're keen to get them to travel, help them where we can. As I said, 7,500 or thereabouts flew last week with PIA, and now we're encouraging people to register interest for these charters. We'll do 10 flights in the first wave, and I hope that will enable people to get home.
So for the viewers who are interested in knowing the details, is this just Qatar Airways, or is there going to be any other airline as well?
So we run it as a charter, which means we tender it to the airline that we think can best.
Okay.
This first group of 10, it's just Qatar. PIA are still flying some flights. So for people, if you have a ticket with PIA that you want to use, then of course you can go to a PIA office, you can talk to PIA and see if you can use that ticket or decide whether to go on our flights. Our flights will cost. They will be ticketed. The price is £527 a ticket. So there is a choice there for customers to decide which they want to go with.
Okay, and I read somewhere that there was some emergency fund announcement as well in case somebody wasn't able to pick up the tab for the ticket.
Yes, and we're very conscious that people may be short on funds, finding these costs difficult. I know that some flights were cancelled, and that's quite stressful. So what we say is that if people genuinely cannot afford to pay for these ticket fares, then they're able to get in touch with us, and if they've got no alternative option, we will give them an emergency loan, emergency financial assistance to get them home. And as with all of this information, it's both on our social media accounts. My account is C Turner FCO on Twitter, or on our travel advice pages, and there's details there of how they can access that emergency assistance.
So is the operation in terms of taking people from Pakistan, is this one of the largest in the world? I'm sure you had people wanting to return to the UK citizens from different parts of the world.
It is one of the largest in the world just because of the sheer scale of that number, that 100,000 Brits in Pakistan. And if I tell you that in that week where we flew with PIA, 7,500 people returned, that was more in that week than in the rest of the world combined had flown on charter flights. So it gives you a sense of how important Pakistan is to the UK, but in the scale of this that we have to deal with. And that's why I predict also that there will be further flights after this first batch of 10. I can see already the demand is high, so we will look at what we can do beyond this first round of 10.
Interesting. So just a very kind of obvious question, which may not seem so obvious to you. Things in the UK, and I mean, our sympathies with the UK, our prayers are for people in the UK, given the fact that how terrible the situation has been in the recent few weeks. Why would people, if they're sitting in Pakistan at a time when things here look, touchwood, somewhat better, why would people want to go to the US, go to the UK at this point?
Yeah, it's a very fair question, and the trouble is that this disease has struck across the world. It's a global emergency.
That's true.
The simple answer, Nasim, is it's people's home. And at tough times, people want to be at their homes with their loved ones. So these flights are not being offered to everybody. They're being offered to these short-term travelers whose home is in the UK to enable them to get back. That's why we think it's important to help them. You're right, the disease is further advanced in the UK. The lockdown measures that we're seeing in the UK are more severe than they're here in Pakistan. And the pressure on the healthcare system is very, very strong. Our amazing frontline medical workers in the NHS doing an incredible job. So for all those reasons, people might make a choice about where they want to be. But ultimately, I think people want to be in their homes. My home is here in Islamabad. My family are with me here in Islamabad. But for others, they'll take the choice that they want to be back in the UK. So
obviously that's a fair answer. People would like to be back with their family. So in organizing this operation, major operation, how much support have you got from the government of Pakistan?
So we've worked very closely with the government of Pakistan throughout this effort, and I really appreciate their cooperation and collaboration. Of course, they face a similar issue with Pakistanis stranded overseas who want to get back to Pakistan. So we couldn't have done this without working very closely throughout the government system and indeed with our partners at PIA.
So in terms of taking people back from Pakistan, how is it working? Are the UK citizens being put in quarantine here? Will they be put in quarantine there once they go back to the UK?
No, so our measures in the UK are actually a bit different to here in Pakistan. So the first thing travellers need to be aware of is if they arrive at the airport, there will be checks at the airport put in place by the government of Pakistan. And if people present with symptoms, there'll be a temperature check. Then they could be put in quarantine before they get on the flights. Once they're on the flights, they get back to the UK. We do not have quarantine measures on arrival in the UK. even though, well, perhaps because the disease is much more prevalent in the UK. And so the advice in the UK is to go as quickly from the airport to your home as you can, to get home and to isolate in line with the current advice from the British government and Public Health England.
Okay, so obviously different systems are being adopted in two different countries. So if we come back to the virus itself, is there any major breakthrough that's expected in the UK, High Commissioner, as far as vaccine is concerned or any kind of cure is concerned?
Yeah, well, I wish I knew the answer to this question. We're all hoping to hear this positive news. And I should say that the UK government is at the forefront of the research. We've put, I think, over £200 million of money into trying to help these companies come together and find a vaccine. For now, it seems to be a way off because of the science, how long it takes to develop these things. So we're left with this complex approach of trying to keep people at home, encourage social distancing, keep good basic hygiene up, and continual testing. It's very clear that the testing approach is very important in all countries.
Okay, so there are Pakistanis who are stranded in the UK as well, wanting to come back. Is there any close cooperation between you and the government of Pakistan on that? And if any, can you just tell us a little bit about that?
Yes, and of course there are people who want to come in the other direction, and I stay in close touch with my counterpart, the Pakistani High Commissioner, Nafis Zakaria in London, and Nafis has been looking as I have at how to get people back. And I think because some of these PIA flights will be continuing, that will give people an opportunity to book on those and come from the UK back to Pakistan.
So, High Commissioner, there's been a lot of talk. I mean, when you look at the international media, international, players in the game right now, not the game, I mean, in this tragedy, in this challenge, there's a lot of talk about air travel and the problems and the disease spreading during air travel. And that would be a valid question to raise then if you're talking of taking passengers back and forth coming from the UK or going from here. How have the two governments looked at that issue?
So I think it plays to your previous question that there are different operating procedures in different countries, and some countries have grounded their airlines and their fleets. Others are carrying on flying. So Qatar Airways, who are delivering these charters for us, they've been very clear they're going to carry on flying. And indeed, we haven't closed our major airports, London Heathrow, which, is such an important hub globally. Yeah. There are still planes flying in there from around the world. There's good basic practice that we ask on all flights and from everybody, and that's about washing your hands, basic hygiene, and keeping distancing as best as possible. And I'm not an aviation expert, but I understand that there are things called scrubbers on aeroplanes that clean the air and provide, to a degree, some hope that on a flight people can remain healthy.
So you're saying that British Airways is actually it's carrying on part of its operation as if normal?
Yes, it is. And now in some places they can't fly. So, for example, because Pakistan closed its airspace, currently BA are not flying commercial flights here. And in other parts of the world, demand has dried up because many people just aren't traveling. But where they can, British Airways and other major British carriers, Virgin Air, are flying.
They are actually flying. So if we now move towards Pakistan-UK cooperation in these very challenging times, I was reading somewhere that in the emergency center that Pakistan has set up, there is information, some support and information gathering, etc., that's come from the UK. Is that correct?
Yes, that is correct. And look, the main message here is that close friends have to stand together at difficult times. And there's two things that we are looking to immediately do. The first is to help with that immediate healthcare response. And today I've announced £2.6 million of assistance to help with the frontline healthcare systems, the data processing, and it includes that surveillance. And I'm enormously impressed by the work that the EOC, the NIH are doing. Dr. Rana Safdar is an incredible Pakistani who is running this. And it's a polio surveillance system that was set up with, over time, over £12 million of British assistance and other countries. And that polio effort has now been flipped to have a close look at how COVID is behaving. And it's their data that is feeding those daily figures that we see on your news channels, in the daily media, to have a better understanding of what is happening with COVID. So it's a really good example of how British expertise, British collaboration with real Pakistani brilliant people putting together to make sure that the decision makers in Pakistan have got the best understanding of what is actually happening on the ground.
So it's more about data collection, etc. If you were to talk about it a little bit more.
Well, it's about data collection, but about surveillance. So because of the lag in the disease from infection to actually getting ill, one of the very important things is to spot where the cases are, and to really focus, as I said, on testing, but then on tracing people that are being tested positive, who they've been in touch with, and if necessary, isolating them or quarantining them. So for that, you need good data on the ground. So this system that Dr. Rana has set up has people working in healthcare facilities around the country, basic healthcare as well as secondary and tertiary, and has a lot of staff who will be able to spot that if someone comes in with problems breathing, with those symptoms of a fever and a cough, that they can identify that that is COVID and look to treat them in the proper way and stop others becoming infected.
Okay, so, and on the other hand, if we look at the UK health system right now, there seem to be a lot of Pakistani doctors there in the UK. And in fact, I think several doctors have even passed away in the last few weeks while actually serving
It's tragic, Nasim, and these are people who are absolutely on the front line doing incredible work. And my understanding of the science is that the more you get exposed to this virus, there is something called viral loading, which can overwhelm your immune system. So these people are showing incredible courage and bravery and service in carrying on treating patients, and tragically some have died. As everywhere in the world, the best response to that is good what we call PPE, that personal protection equipment, the masks, the gowns, the gloves, having enough of those so those frontline medical workers can be best protected as they treat the sick.
Yeah, so there was some mention about Deferred Support, that it was now going to be reoriented towards looking after the most vulnerable, especially since the outbreak of the pandemic. Could you talk a little bit about that?
Yes, thank you. So that's the second area. I mentioned the first area is in our help to focus our support on the primary healthcare, the immediate healthcare response to try and stop the advance of the disease. Then secondly, we need to help Pakistan deal with the consequences of the virus. And that is about livelihoods, that's about the economy, about people's access to food, all of those issues that we need to make sure are in place. I think the economic assistance is very important. Prime Minister Imran Khan calling for debt relief for major countries, which I'm pleased was agreed at the G20, a group of countries, the ministerial meeting earlier this week. And also then the scheme, SR scheme, to help the poorest have access to cash and food. For those on a daily wage, this is very, very challenging. So we're supporting all of those areas, and DFID's assistance, which, of course, we are the largest bilateral donor to Pakistan in the UK. All of that assistance is being repurposed. Things we were spending money on, things we were supporting, programs that were relevant 2 months ago, have now got to completely shift to the coronavirus world, to the COVID environment. And so we're looking at all of that work and trying to repurpose it to where it is most needed.
So you're saying DFID has contributed to the SR's program. Obviously, the Prime Minister of Pakistan is quite focused absolutely on, going after areas where the economically depressed in this country are basically needing support. And within that context, you're saying that the UK government has supported the SR's program.
Yes, indeed, and the UK has long been a supporter of SARS and BISP, the Benazir Income Support Programme before it, and it's an important part of our assistance that I hope will continue.
And you're supporting the federal government, or High Commissioner, you're working with the provincial governments as well as during this pandemic period?
Yeah, there's a bit of both. So we work at federal level. We also work at provincial level, and we try and support areas where people are the most vulnerable. So we do a lot of work, particularly in Punjab and KP. I will give you an example. A program we were running that was trying to support people with basic nutrition and give advice on people on how they could have good diets and support their nutrition. We're trying to move that program from talking about nutrition to talking about hygiene, about sanitation and washing your hands and keeping distance. Quite an easy thing for us to do, to flip an area of work that was relevant before COVID to be more relevant now in the age of COVID.
So you mean you moved fast enough and not any bureaucratic wrangling has kind of delayed that? You've been able to make the switch quite fast.
It's really important that we're agile and we can move quickly. Bureaucracies, it's no different in the UK to here in Pakistan, can be slow. Yeah. And I'm really hoping that my team, we can move quickly to get the support where it's most needed. And it comes back to that message on friends and close partners standing together at these times of need.
Yeah, well, let's hope these two partners come out ahead of this pandemic. This is a bad time, but a good time to be working with friends. Thank you so much, High Commissioner.
Inshallah, thank you. And I think, particularly as we approach Ramadan, that point on friendship, on reuniting with families and compassion, supporting each other is what we have to do. So, inshallah, we will come through this. It's very good to talk to you. Thank you very much indeed.
तो नाज़रीन, आपने गुफ्तगू सुनी पाकिस्तान में यूके के हाई कमिश्नर हैं, उनके साथ हमारी तरफ से आज इतना ही। खुदा हाफिज। पाकिस्तान जिंदाबाद।
24 न्यूज़, बाखबर 24 घंटे।